Hello students. So we have started with biomedical waste. So biomedical waste is any solid or liquid waste or both solid and liquid, including its container and any intermediate product which is generated during the diagnosis, treatment or immunization of human beings or animals is considered as the biomedical waste. So it includes different tissues, organs, body parts of both human beings and animals which are generated even during the research laboratories or any treatment. Then it also includes the waste sharps like hypodermic needles, syringes, then scalpels and broken glasses. Then even it also includes the bandages, plaster casts, and the materials which are contaminated with blood, tubes, etc. Even the chemicals, then liquid waste, all these are included under biomedical waste. Then we also have seen the categories of biomedical waste, schedule 1. So there are 10 categories. So in that 10 categories, what all types of waste will come, that we have discussed, and how it is treated and disposed of. Now, for any type of waste, the first thing what we have to do is segregation. So what is segregation? Segregation refers to the basic separation of different categories of waste generated at the source, and thereby reducing the risk as well as the cost of handling and disposal. So segregation means what? It refers to the basic separation of different categories of waste, like syringes at one side, solid waste one side, liquid waste one side. So all these segregation at the source is very important, especially in case of biomedical waste. So segregation refers to the separation, the basic separation of different categories of the waste which are generated at the source, and thereby reducing the risk as well as the cost of handling and disposal. So if you adopt the segregation of the waste at the source, means where it is generated, so you can reduce the risk as well as the cost of handling and disposal of the waste. So segregation is most crucial step in the biomedical waste management. Then effective segregation alone can ensure effective biomedical waste management. So biomedical waste generated from a healthcare facility is required to be segregated at the point of generation as per the color coding stipulated under Schedule 1 of Biomedical Waste Management Rules 2016. So according to the Biomedical Waste Management Rules 2016, the biomedical waste which are generated from any healthcare facility, they are required to be segregated at the source, and it has color coding. Okay, so the following activities to be followed to ensure the proper waste segregation. So to achieve the proper segregation, the essential thing what we need to do is proper leveling of the bins. So this is very important or crucial step in the first step, you can say, in the management of biomedical waste. So the bins and the bags in which you are dumping the waste, they should carry the biohazard symbol indicating the nature of the waste to the patient and the public. So the bags or the bins in which you are dumping the waste, they should carry a biohazard symbol. So in the figure, the different symbols for the different hazards are given, like cytotoxic, that is the symbol where C is written, then inflammable where fire is shown, toxic, danger, okay, gas bottles, explosives which burst, then radiations, biohazards, then corrosive, and health danger. So these are different labels which we can paste it on the bins or the bags. So labels shall be non-washable and uh, prominently visible. So they should be clearly visible, and they should not be washable. They shall be non-washable. Then Schedule 3 Rule 6 of Biomedical Waste Management and Handling Rules 1998 specifies the label for biomedical waste container bags, that these are the symbols which are specified in the Schedule 3 of the biomedical waste management rules. So if you have adopted proper labeling, the further things of treating and disposing of the biomedical waste becomes easier. So these are the different labels which are used for labeling the bins. So I mentioned about the color coding and type of the container that comes under Schedule 2. So color coding you might have seen in different hospitals or any medical facility. You can see the different colored bins are used for the waste management, that is especially the biomedical waste management. So yellow color, red color, blue or white, and black. So these are the 4 color codes which are given according to the rules of biomedical waste management. So yellow, red, blue or white, or it is transparent, and the black. So these are the 4 color codings which are provided. So what a type of container it is? So if it is a yellow color, you can dump all the plastic bags in it. And the what type of category of the waste it includes? That is category 1, 2, 3 and 6. So category 1 includes your human and anatomical waste. Category 2 includes the animal waste. Category 3 includes your microbiology and biotechnology waste. And the category 6 includes soiled waste. Okay, so like the items which are contaminated with body fluids, including your cotton dressings, then plaster, all these are included under category 6. So all these where you have to throw, we have to use yellow colored bins for disposal of these category of the waste. Then the treatment option includes your incineration or deep burial. So you can either go for incineration, that is burning, or you can go for the deep burial of the waste. Then the next color coding is red color. So disinfected containers, plastic bags, you can throw into the red colored dustbins. So the category included here is 3, 6 and 7. So category 3 is your microbiology and biotechnology waste. Then the category 6 includes your soiled waste, and the category 7 includes the solid waste which is generated from disposable items other than the waste or the other than the waste sharps, such as your catheters, then tubings, etc. So these are included under category 7. So disinfected containers, plastic bags, they are having the red color coding. So what is the treatment option for this type of waste? That is autoclaving, microwaving, or you can adopt chemical treatment. Then the next type of container includes your blue or white transparent containers. So here the type of container what you can throw in it is the plastic bags, then puncture proof containers. So they should be puncture proof, and that is a plastic bag you can use there. So what type of waste are included in this type of containers is 4 and 7. Category 7 includes your solid waste, and the category 4 includes your waste sharps like your needles, syringe, scalpels, blades, glass, etc., which are sharp. Okay, so the sharp waste is the blue color or white color containers are used for these type of waste, that is category 4 and 7. So what type of treatment method we can adopt for these waste is autoclaving, microwaving, chemical treatment, then destruction and shredding. So all these are the options for treatment of the biomedical waste which are under 4 and 7 category. Then your last type of dustbins includes black color coding. So again you can use plastic bags, the type of container. Then the waste category includes 5 and 9 and 10. So 5 includes your discarded medicines and cytotoxic drugs. Okay, category 5 includes your discarded medicines and cytotoxic drugs. And the category 9 includes your incineration ash, that is after burning of the biomedical waste the ash is formed, that ash is called as incineration ash. And the category 10 includes your chemical wastes, so the chemicals which are used in production of biologicals, chemicals which are used in disinfecting as or as insecticides. So all these are coming under category 10. So whatever solid waste which is arising from category 10, that can be dumped into the black color coding. So what is the treatment method? That is disposal in secured landfill. So as it is a solid waste, so you can dispose it in secured landfills. So this is all about the color coding and type of containers in schedule 2. Then we'll see how the collection of the biomedical waste is done. So the collection of biomedical waste involves the use of different types of containers, that is colored bins, just now we discussed, yellow, red, blue or white, and the black color. Okay, so all these color codings you can use it. So different types of containers with color bins from various sources of biomedical waste like operation theaters, laboratory, then wards, kitchen, corridors, etc. So from all these, whatever waste, biomedical waste is generated, that is collected in the containers with different color bins. Then the containers or the bins, they should be placed in such a way that 100% collection is achieved. So the location of the dustbins also plays an important role. So they should be properly placed. The containers and the bins, they should be placed in such a way that 100% collection is achieved. Then the sharps must always be kept in puncture proof containers to avoid the injuries and infection to the workers who are handling the biomedical waste. So you have to be very careful. You have to use all the safety measures. So this is all about the collection of the biomedical waste. Then comes your storage. Once the collection occurs, then the biomedical waste is stored in a proper place. So the segregated waste of different categories need to be collected in identifiable containers. The duration of the storage should not exceed for 8 to 10 hours. So whatever waste you are collecting, that should not remain more than 8 to 10 hours in big hospitals, and more than where it the patients are 250 or more. Okay, and 24 hours in nursing homes where the number of patients are less, there we called as nursing homes. So in nursing homes and all, it should not be more than 24 hours. So daily you have to dump the waste. So if your hospitals are big, then you more than 250 bedded, then it should not exceed 8 to 10 hours. 8 to 10 hours. Okay, then the each container may be clearly labeled to show the ward or the room where it is kept, and the reason for this labeling is that it may be necessary to trace the waste back to its source. So for that purpose, it will be written on the top. Then beside this storage area should be marked with a caution sign. So the storage area should be marked with a caution sign. So this all comes under the storage, that is proper storage of the waste. Okay, according to the different categories how we are segregated the waste, and you should not keep it for more than 8 to 10 hours in big hospitals, and more than 24 hours in small nursing homes. Okay, so the here labeling is very essential. Labeling plays a very important role in storage and collection of the biomedical waste. Then comes your transportation. So once the waste is collected, it has to be transported. So transportation means the waste that should be transported for treatment either in the trolleys or in the covered wheelbarrow. So anyone you can use it for the transportation of the biomedical waste. Then manual loading should be avoided as far as possible. So we have to adopt for mechanical means of loading the waste into the vehicle. Then the bags or the containers containing biomedical waste, they should be tied, then they should be lidded before transportation. Means they should be properly covered, they should be properly tied before transportation. So before transporting the bag containing biomedical waste, it should be accompanied with a signed documents by nurses or doctors mentioning the date, shift, quantity and uh, destination. So all these should be clearly mentioned on the bag, wherein you have collected the biomedical waste. Then the special vehicles must be used so as to prevent the access to and direct contact with the waste by transportation operators, the scavengers, and the public. So we have to be very cautious about the while transporting the solid biomedical waste. Then the transport container should be properly enclosed. The effect of traffic accidents should be considered in the design, and the driver must be trained in the procedures he must follow in case of any accidental spillage. So there are chances of accidental spillage. So to avoid, you should train the driver so that he can take immediate action and save the lives. So it should also be possible to wash the interior of the container thoroughly. So you can wash the interior of the uh, container in which we have collected the waste. We have to wash it thoroughly. So this is all about the transportation of the solid waste, biomedical solid waste. Thank you.